Begin a manual breast pumping session by washing your hands and ensuring all pump parts are clean and assembled correctly. Sit in a comfortable position and relax your shoulders and arms. Place the breast shield over your breast, centering the nipple inside the tunnel. Start pumping with gentle, slow squeezes to stimulate milk letdown. After milk begins to flow, continue pumping with steady, controlled squeezes. If milk flow slows, pause briefly and massage your breast to encourage further expression. Switch breasts when one side feels soft or empty. When finished, remove the pump carefully and seal the milk container. Proper technique and comfort help make each manual breast pumping session effective and comfortable.